My name is Chris Grosso. I'm 61 years old. I've had pretty, athletic childhood, normal. Played hockey, played soccer. When I was out of college, I had some work done, and they noticed I had pretty high blood pressure for a young guy. And I just lived with it, and it got completely out of control in my 40s and 50s when I had kids. So then they're giving you medicine for your high cholesterol, which is killing my legs, making me mushy-brained. And so then I would change and go to another cardiologist, never could get to the root cause of blood pressure. My doctor, he even said, this is crazy. You're a ticking time bomb. Being a guy who always worked out, always, tried to take care of myself and kind of athletic, it really was frustrating.
One of the most predictable cause for heart attack, stroke, and cardiovascular death and disability is high blood pressure. My name is Dr. Sangvi. I work for Virtua Health. As an interventional cardiologist, one of the common problems that we take care of is the patients coming in with a heart attack. And it's one thing that you go in and open a blocked artery and treat the patient, but then you also think, what could we have done to prevent that?
I just felt this connection where, okay, this guy's listening to me.
Chris came to see me in the office with the hope that I'll be able to offer him the renal denervation treatment, but at that time we were not, because it still was an investigational device not approved.
I said, what do I do now? He said, well, I'm not going to abandon you. I went back the third time, and that's when he said, I have really good news. And he said, the FDA just approved this.
I was part of multiple different clinical trials, starting from designing to executing the trial and enrolling patients, as well as analyzing data and writing papers about it. As the FDA approved the procedure and it became available, we reached out to him to suggest that he could be treated with renal denervation, and he was ready for it. High blood pressure is a very common problem. The first line of treatment is still your diet, controlling salt, taking DASH diet, exercising regularly, quitting bad habits such as smoking or controlling alcohol intake. These are the first line of treatment. If the medication controls your blood pressure, this is not the treatment for you. But if you have tried multiple medication, you have difficulty complying with the medication, you are getting side effects, or you are resistant to the treatment, the number one goal is to lower the blood pressure.
The thing that struck me was the amount of care. It was really good care. I was only there 8 hours, but it was very hands-on. Within a week, my anxiety was gone. My blood pressure had dropped considerably. I was back to work. I didn't take any time off.
As a physician, the maximum reward happens when your patient gets better. So it feels great that I was fortunate to be part of this journey for so many years, and we're able to work through to get this treatment available to our patients.
And I'm more active. I'm just more relaxed, and my kids notice it, my wife notices it, that I'm just calmer, and I just feel way more stable at work. I could get more things done now, and I'm more focused, so it's nice. It's wonderful, actually. Dr. Sangvi is now my full-time cardiologist, so I'm going to be coming down here all the time, so it's worth the drive.